Good afternoon, everyone, and thank you for joining us again. Today I have some terribly sad news to announce. Among the fatalities over the last 24 hours was a state employee, a member of our team at the Department of Human Services, and an infant. May their memories be a blessing. I know how difficult this news can be, especially about this very young child. Upon hearing it, I admit I was immediately shaken, and it's appropriate for any of us to grieve today. It's especially sorrowful for the family of this very small child, for the years stolen from this infant. We should grieve. We should grieve with our family of state employees, with the many people who we've already lost to this virus, young and old. We should grieve for the loss of a sense of normalcy that we left behind just a few weeks ago. It's okay today to grieve. I've learned through personal experience that grief is a bridge. It gives us permission to experience the sadness that we need to feel in order to move forward. It helps us empathize with the people in our community that are hurting. It helps us to lift them up. And I'm here to tell you maybe the most important thing that I know, that this will pass. We will carry our lost family members and friends with us forever. And someday their memories will not bring grief, but the grace we need so that we can live on and love again. I also want everyone to know what I've learned from the experts that I rely upon, that COVID is rarely fatal in children, that sending home state workers who are non-essential has kept many from contracting COVID-19, that the drastic and necessary measures that we've taken as a state to slow the spread of this disease are the right course of action. Today marks 1 week since our stay-at-home order was put in place. We're increasing testing capacity every day. We're stopping at nothing to obtain supplies and equipment that we need for our hospitals and our medical workers. And I'll continue to do everything necessary to bend this curve and to keep Illinoisans safe and healthy. Based on science, data, and the guidance of health experts, our approach to fighting this virus is two-pronged: suppress the spread and increase hospital capacity to meet the need. A critical component of our increasing our capacity is identifying and building out additional facilities across the state to support our existing hospitals and healthcare systems. IDPH, IEMA, the Illinois National Guard, and the Army Corps of Engineers have been hard at work collaborating with our local officials on where we're seeing the largest concentration of potential additional need. In partnership with the City of Chicago and the U.S. Army Corps of Engineers, we're planning to use the city's McCormick Place Convention Center as Illinois' first field hospital. I'll provide more details on this effort for the public in the coming days, but the baseline is that we're not waiting for the worst. We're preparing ourselves for the worst. My team also continues to scour the global supply chain for PPE and has already placed orders for millions of units of PPE. We've been shipping these out to the counties across the state as needed and as they arrive. I'm proud that we've had the support of hundreds of businesses and thousands of people who have reached out with donations and to ask how they can do more. On behalf of the doctors and nurses and the healthcare workers all across our state, in addition to IEMA and IDPH and my team at the governor's office, I want to express my eternal gratitude to each of the individuals and companies that have thrown their own stores of supplies and equipment into the mix. Each mask or gown or set of gloves will make a difference for one of our frontline workers and all of our donors should be extraordinarily proud of the part that they've taken in fighting this COVID-19. And because we're receiving their donation this afternoon, I want to specifically recognize McDonald's Corporation, headquartered here in Chicago, for today giving us an additional 400,000 N95 masks to protect our essential workers in the fight against COVID-19. If you or a business owner that you know thinks that they might have supplies that could help, including tattoo parlors and nail salons and elective surgery centers and podiatry clinics and dermatology clinics and even construction companies, I encourage you to contact us, and a member of my team will be in contact with you. The email to send to us is at ppe.donations@illinois.gov, ppe.donations@illinois.gov. My team is also doing everything in our power to make sure that all of our residents can access the health care that they need in these trying times. This is especially true for our Medicaid population, more than 3 million in Illinois, and those who suddenly find themselves in need of health insurance too. We've put in every waiver that we can with the federal government to expand health care availability during this period. Number one, we've worked to ensure that no one will lose Medicaid as we work to stop COVID-19. We're asking to temporarily suspend the annual renewal process that Medicaid recipients normally go through. Number two, we've worked to fast-track Medicaid enrollment through the elimination of time-consuming review procedures, as well as the suspension of numerous co-payments, spend downs, and asset verifications, making it easier than ever for new applicants to get assistance. Three, we've worked to guarantee covered costs for COVID-19 treatment to all of our uninsured residents, regardless of income. And four, we've worked to have all our insured residents covered for any out-of-pocket expenses relating to COVID-19 treatment costs. We've already received waivers allowing us to suspend prior authorizations, meaning doctors and providers don't have to wait for approval before they can offer Medicaid care, and streamlining our enrollment system on the provider side. Finally, we're exploring how to allow any medical provider in Illinois to bill Medicaid. We're also awaiting approval of a waiver to further expand home-delivered meals to help people stay at home and still get the nutrition that they need. Finally, before I turn it over to Dr. Ezike, I want to touch on our work to ensure that all our residents can access food, the food that they need when they go to the grocery store, in as safe a manner as possible. Since my previous announcement about grocery stores offering dedicated hours to older and more vulnerable shoppers, we've continued to work with the Illinois Retail Merchants Association to make shopping a safer experience. That continued reassessment has resulted in a new best practice that grocery stores will be rolling out in the coming days. In fact, several new procedures. These include signage at the entrance and throughout the store alerting customers that they must follow the 6-foot separation rule. 2, continuous announcements of social distancing rules throughout the store on their PA systems. Setting up floor markers to socially distance at checkout lines. Encouraging cashless purchases for speed at checkout. Dedicating staff to regularly walking the floor to help customers follow the social distancing rules. Placing shield guards in front of the cashier or the bagger that may not be 6 feet away from the customer. Temporarily prohibiting reusable bags. Encouraging the use of online ordering and curbside pickup, and encouraging the use of self-checkout lanes to reduce the number of interactions our grocery store employees have to make with customers. To be clear, there's nothing new that customers need to know before shopping other than to be vigilant about their social distancing practices, as we're asking stores to make their requirements as clear as possible. but it is up to each individual to follow our social distancing requirements. As your governor, I ask you to be courteous and be respectful in any interaction with the grocery store clerks and workers always, but especially as they go to work every day when so many are staying home, and especially if they ask you to comply with one of these guidelines. Remember, they're looking out for you as much as they are looking out for themselves or anyone else. Thank you, and now I'd like to turn it over to Dr. Ezike for today's medical update.
Thank you, Governor. I know it's obvious to all of you, but it is really a privilege to serve under this governor. His passion for the people of Illinois and his intense diligence to make sure that we weather this storm until its end. Thank you so much for your commitment. Today is a really hard day. I'm reporting 465 new cases and 13 additional deaths, including the tragic death of an infant. There has never before been a death associated with COVID-19 in an infant. A full investigation is underway to determine the actual cause of death. I want everyone in Illinois to take COVID-19 serious. If you haven't been paying attention, maybe this is your wake-up call. We do know that COVID-19 leads to death, but it also leads to recovery in the majority of cases. To minimize the number of deaths, let's practice social distancing. Let's stay at home. Let's wash our hands. Let's cover our cough. Let's clean frequently touched surfaces. We must continue to do everything we can to prevent the spread of this deadly virus. If not to protect yourself, then please do it to protect those around you. Yes, older adults are at highest risk of severe illness. More than 85% of the deaths in Illinois are among individuals 60 years of age and older. Studies show that diabetes, heart disease, lung disease, liver disease, being on hemodialysis, pregnancy, these are things that put people at additional risk. However, people of all ages and people even healthy will and have contracted the virus and can develop severe illness, including death. Right now, the only way to stop the spread of this virus is to reduce the number of people infected, which means reducing the number of people exposed. Again, that leads us back to what we need to do. The best way to accomplish this is to stay at home. I'm sounding like a broken record because the truth remains the truth. These actions will help us end this pandemic. We must continue to take this coronavirus seriously. Even if you might only have a mild illness, that same illness spread to someone else could have a very tragic result. Let's protect all of our fellow citizens. And now I will summarize the comments in Spanish. Buenos tardes, me llamo Ngozi Ezike y soy la directora del Departamento de Salud Pública aquí en Illinois. Hoy tenemos 465 casos nuevos en 13 muertes adicionales, incluso la trágica muerte de un bebé. Este es el primer muerte asociada con COVID-19 en un bebé en el mundo. Empezamos una investigación para determinar la causa de muerte. Todos deben creer que COVID-19 es serio y afectar a todas personas de todas edades. Debemos hacer todo posible para prevenir la transmisión de este virus, si para protegernos mismos, sino para proteger a nuestra comunidad. Sin embargo, las personas de todas las edades podrían sufrir enfermedades graves. En este momento, la única forma de detener la transmisión del virus es reducir la cantidad de personas infectadas. ¿Cómo lo hacemos? Nos tenemos que quedar en casa. Puede sonar como un disco rayado, pero estas son acciones que todos deben tomar para poner fin a esta pandemia. todos debemos tomar en serio este nuevo coronavirus y debemos continuar luchando para todos, incluyen queridos mayores en todo Illinois. Vamos a salir de esto juntos. And with that, I will turn it over to Governor Pritzker.
Thank you. Happy to take any questions. Shia.
Hi, how are you? So President Trump has called for a full quarantine in New York City. Are you concerned that could happen here in Chicago? And if it does, what would that mean beyond what we're doing already?
It's unclear. I think what the president, I'm not sure that he actually completed the call for it. He suggested that he may call for it. Look, I have to say that New York, New Jersey, that entire area, several of us led in our stay-at-home orders relatively early. Indeed, I think we were among the very first states. And so I'm not sure, what the president has in mind in terms of quarantining. But if we here in Illinois do what people should be doing, following the rules according to the stay-at-home order, then, we will be able to bend the curve here. But I think we're all deeply concerned about what's happening in New York, and clearly it's happening in New Jersey. There are hot spots around the nation, and Chicago is now being referred to by some as a hot spot. So we're all watching what's happening and how the president and the federal government are reacting to them, because at some point we too are going to be reaching a peak, and we will want to know what can we expect from the federal government, because frankly so far we haven't received enough support for what we think we're going to reach as a height of ICU admissions and hospitalizations.
1 week into the stay-at-home order, what are you seeing, what are you hearing on the ground? Are you happy with what you have ordered? Are people obeying it? Could it be better, could it be worse?
Well, let me start by saying that the vast, vast majority of people in Illinois are doing precisely what we ask them to do. But it's the others, the people who aren't obeying this stay-at-home rule, that are putting everyone in danger. It doesn't take that many people, frankly, to break the rules and to cause danger to others in their community. People are, I don't know, they aren't listening. They haven't heard what Dr. Ezeka has said. Maybe they aren't turning the television on and watching the national news. I'm not sure why people are ignoring this, those who are. But as I said yesterday, and as I've repeated over and over again, people need to do what's right. And right now, the fact that you're bored, that you feel like you want to go get a pick-up basketball game going with your friends, I'm sorry, but this is not the time for it. People are going to die if you don't obey the rules. Please, please stay at home. Do your best to follow the rules.
We'll do one more in here, and then we got to get to the
Shia.
questions online.
To what extent are you concerned that police and fire are contracting the virus?
I'm deeply concerned about first responders, police, fire, healthcare workers, obviously. And we have provided for police departments, fire departments, and first responders the kind of PPE that they need in the near term. And as we acquire more PPE, we'll make sure that they have the stores that are necessary for the days going forward. It's very important for us to make sure that those very essential workers, those first responders, are kept safe. And as you saw, we opened up a special testing facility just for our first responders and our healthcare workers to make sure that they get priority in this effort, and they have the ability to get that test as soon as they are deemed by their doctor appropriate to get the test.
Does the state have staff working 7 days a week to process unemployment claims? If so, is that the first time in state history that this has been done?
Well, we've never seen this kind of application, deluge that's happening to the state. So we're working every day to make sure that we're being responsive. We've asked people to stagger their application processes, their calls, as well as their online applications, because frankly the systems weren't built, nor was the staffing built to withstand this kind of onslaught. Nevertheless, we had our best day ever in the history of IDES on Friday, where we had a lot of incoming applications, and the system held up well to take in those many applications. So we ask people again to have some patience. We're working through some of the challenges, but also to work with us.
Okay, and we'll take some from
Yep.
online. For what you have learned about COVID-19, do people get it, then recover, and then become immune, or can you become reinfected by the virus?
I'm going to hand it over to the professional.
So again, I've been scouring all the articles from around the world in terms of trying to amass all the knowledge about this virus. This virus seems to be a stable virus in that it doesn't seem to mutate very significantly. So if you get this virus, we think that you develop antibodies within less than a week, and we think that that will give you immunity.
And may I add, because I think this is very important for people to understand, those who have contracted it and who recover, if it is true, as I think most epidemiologists now believe, if it is true that you essentially develop the antibodies that makes you effectively immune from getting it again, that means that there are cadres of people, lots of people who already have recovered, who can't get it again, and therefore, as we start to develop a larger number of those, we can test for that. Many people who caught it never were tested for it, recovered, thought they might have had the flu or a cold. We can test for that in the aftermath. And I think we're going to find that we have many, many, many people who are immune. We still have many people who haven't gotten this yet, so that's the danger that we have in society.
Governor, you obviously have teenage children. How do you as a father talk to them about what's happening with COVID-19, and what advice do you have for parents in explaining what's going on with the pandemic to their children, and especially young children?
Well, I certainly have admonished my children to follow the rules, and they have. It's not easy. Our kids, and I think many kids, are used to using the internet to communicate with one another, so that's, I think, a benefit to them that maybe we didn't have as kids. But in talking to them, I've also said, don't watch TV news because, it's okay to keep up with news, and I'm sure that they do. I know that they do. But don't watch all day. Don't turn on CNN or MSNBC or, God forbid, Fox, and try to follow this through the news. It's not worth doing. And then I just add one more thing, which is, for very young children, I remember the just immediate aftermath of 9/11. And I think it's very important for children to ease the concerns of their very young children and let them know we're going to get through this. And I want to say this to everybody that's watching and listening today. We are going to get through this. We are. We're working very hard to make sure that we keep everybody healthy and safe. We are going to get through this. And when we get on the other side of it, I think we'll look back and say we did everything that we could, and I think did the right things at the right times.
There have been concerns expressed by members of the public about delays in getting testing results back. How long does it typically take for test results to be processed?
So let me say this. There are different laboratories that have different turnaround times, and of course, the more specimens you take in, if you have a limited amount of capacity to process those tests, there can be a lag in returning the results of those tests. The commercial laboratories that the federal government has contracted with are inundated, and it is taking more days to get something back from a commercial laboratory, which used to be the fastest providers, than it does to get a test back from our state labs or from your local hospital or provider that has their own testing capability. So we're trying to, talk to the federal government about speeding up that process, but more importantly, here in Illinois, we're acquiring more testing capability and not only the test kits, as we've talked about in the past, and all the pieces of the supply chain, but the actual machines that are doing the work of giving results. And so we're building up our internal test capability and lab technicians and all of the supplies so that we can do it better and faster within the state of Illinois, because the federal government, honestly, their process has not delivered fast results.
If the governors are bidding against each other for things like PPE and the federal government is not overseeing this, why don't the governors just organize themselves to buy as one and then divide up the goods? Maybe the states could come up with a voluntary buying consortium.
Well, that question sounds like it came from a business person, because I have for many days now been working with other states. I have talked to other governors about their needs, about making sure that we make package demand requests to the various suppliers so that we're, buying in bulk essentially for multiple states. So we're doing that. We're working with different states on different PPE and ventilators and so on. We all have enormous needs. But this points up a problem that you all should be aware of, which is what we ought to be doing is doing these kinds of purchases en masse through the federal government. They should have led this to begin with. I've said this over and over again, and I'll repeat it. The Defense Production Act, which only now has been invoked for one circumstance for one supplier, and that was GM yesterday, should be invoked across the board because there are a lot of manufacturers out there, and as I have said, they are selling often to countries other than the United States, and they have an order book that looks like, one of their customers is FEMA, and then they're competing against New York, they're competing against California, against Illinois, and all the rest of the states that are trying to put orders in. And so those who are at the bottom of the list, and I've tried to move us up those lists, but those who are at the bottom of the list may not see ventilators until, potentially months after they peak in terms of their COVID patients in their hospitals. So that's not going to be very useful for many states.
Is the administration considering any action related to stopping doctors from stockpiling drugs that may be used as a treatment for coronavirus?
The administration does not seem to be stopping any of the stockpiling of drugs. What I know is that it is true that there is not yet a known approved treatment for coronavirus COVID-19. Please take note of that, because I know that there's some misinformation out there that even the president has repeated sometimes. What I know is that we have ongoing tests at our terrific, globally recognized medical institutions here in Chicago and in Illinois. Those tests are around new drug applications. There is one called remdesivir, which is being manufactured by and put forward by Gilead, still unproven, but it has seemed to be somewhat effective so far. The tests have to be ongoing here. We have to get to a result to know, because you don't know what the side effects are going to be, and the side effects can sometimes be worse than the original disease that you're treating or the virus that you're treating. So we're continuing to watch that and to make sure that we're staying ahead of it. And of course, the federal government needs to step in here and make sure that those drugs are available to all the states as needed when they become approved.
And this will be our last question. What is the situation with availability of ventilators in the state? We all see what is going on in New York. How far behind them do we appear to be, and are we ready to handle a similar situation to the one that is taking place in New York?
Virtually every state doesn't have enough ventilators. That's just a fact. There was nowhere in the United States that was ready for a pandemic. The federal government has said they have 10,000 ventilators on hand. Just to give you a sense, New York alone right now says they need 30,000 more ventilators. So the federal government wasn't ready for this either. And to be honest, the current president, although he's blamed previous presidents, also wasn't ready and hasn't gotten us ready, even though we knew for 2 months now that this was going to be a problem. So what we're doing is acquiring ventilators wherever we can. We've collected up the ventilators that are around the state of Illinois. Certainly anybody that's listening to this that knows of a ventilator that has not been contributed to or made available to the state or to a local hospital, please come forward, let us know about that. We're out in the market acquiring as many ventilators as we possibly can. Currently, we don't have enough. We need thousands more than we have today. There is some discussion about ventilators being moved around the country as hotspots flare up, but it's not clear to me whether, for example, New York will start ramping down their need fast enough for Illinois to be able to use what New York currently, needs and may not need at the other side of their peak. So we're not relying upon that. We're just out in the market acquiring any piece of ventilator equipment that we can. And as you may have read, even in the state of Illinois, the University of Illinois Urbana-Champaign has developed a ventilator product that may be usable for us to expand our ventilator capabilities across the state.
All right, thank you, everyone.
Yep, thank you.